Okay, so I apologize for the recording of this episode because I was listening to a podcast and they were kind of bashing on the field of dental hygiene. And so I recorded this entire episode as a result of listening to that podcast in my car before I walked into work. So I was sitting in my car. I was scheduled to work in clinical dental hygiene this day, and I felt compelled to record this episode before I walked in and did my day. I had like 20 minutes. So I was parked in my car. And so it's not the best audio, but I just had to get this off my chest because something in that podcast episode just ignited something inside of me that I needed to share. I needed to share how I felt about this. I'm always advocating for the profession, and sometimes you just have to say it. So I think the message is good. I think it's worth hearing. I didn't want to not publish this episode just because I recorded it in my car with my phone and my AirPods because I really think it's important for everyone to hear. So I hope you listen to it right to the end because it's worth hearing. Thank you for listening and tuning in. Hey everyone, welcome to the Happy Flosser podcast. My name is Billy Lunt. I am your host, and I am here to talk to you about all things dental hygiene to support you on your journey through the dental hygiene program. Welcome, so glad to have you. As an educator, one of my major goals is to help a student learn about themselves, become confident in their abilities, discover the ways that they need to adjust their life to reach their goals, and really realize that this is a journey for themselves to discover who they are, what they believe in, and really what level of resilience they have, because I think we're all capable of much more than we realize. As an educator, I think it's important for us to recognize that students put limits on themselves, and we need to help them take the limits off their life. So for you as a student, I hope you recognize that you put limits on yourselves when you're having challenges, and you can do hard things. You can do the challenge of dental hygiene school. And then I start thinking about how I felt after I graduated from hygiene school. And I felt like I was well prepared, that the school I went to really prepared me for my boards, prepared me for real life dental hygiene, and really prepared me for tackling the op. There were a couple of things that you just had to learn on the fly, like insurance things and the sequencing of fitting, all of your care into a 1 hour appointment. Those were normal things. And today's student, really, you guys have a lot more support in that category at this point, with lots of mentors out there. And it's even some of the things that are talked about as enrichment in your hygiene program, hopefully. But one thing hasn't changed, and that is that all of you are going to fall into the realization that, my goodness, I learned an awful lot in school that I'm not using out in the real world. And then I want you to ask yourself why. And what I'm so excited about is that usually students don't know this, or I'll just speak for myself. I did not recognize this until I was already out in the field. I was well graduated when I realized that my scope of knowledge did not equal my scope of practice, and that I learned way more in hygiene school than I was capable or allowed to use out in the field. And today's student is asking those questions while they're still in school. And that really, it makes me sad, but it makes me happy at the same time, because that means that students are recognizing this. And I'll give you an example. I just had an entire group of students asking me, as they're finishing up oral anatomy 2 and learning about all of the cranial nerves, the muscles of facial expression, the arterial and vascular supply of the face, head, neck, the whole region, why can't they do Botox again? Why is it they're not qualified to do Botox? And to be completely frank, I don't have an answer for them. And it's a great example of how their scope of knowledge is not parallel to their scope of practice. I encourage all students to remain members of the American Dental Hygienists Association after they graduate, because that will help support their efforts to answer that question and make changes in the direction that benefit patients. Now, Botox is just one example, but we could go on and on and on about all different things that the hygienist learns about and is capable of doing in the operatory that they are not allowed to do, and there's restrictions there. We need, as we approach medical dental integration, we really need to support the desires of our students who are graduating and coming out into the field with the latest knowledge and understanding to really say, what are we capable of? And how can we be best utilized to meet the needs of the population? And I think we need to rethink how we're distributing care, who we're distributing care to, and where we're distributing care to. Using the scope of knowledge of the dental hygienist to the fullest capacity is a game changer. Makes big strides, big changes. And it's something I've always had as a question in the back of my mind since I became a hygienist. I'm excited to say that as students, you guys are thinking about it now while you're in school. What I can think about and kind of connect the dots here to as to why is that you went out in the field, and as a requirement to get into the program, you observed a hygienist in the clinical op. Then you come into school, and it's probably the hardest thing you've ever done. The amount of knowledge, the amount of information you have to learn and be proficient and competent in is vast. And you might ask yourself, well, when I observed that hygienist in the clinical setting, I didn't see why she would need to or he would need to know any of this information. That's a really valid question. And with the workforce shortage, we are pressured, just for lack of a better word, to question whether or not we're educating at the level we should be. And so I ask you, how can we provide adequate needs of the workforce while still maintaining the integrity of a program? And that's a question faculty ask themselves all the time. And at the same time, why are we doing what we're doing? Why are we educating our students at the level that we are? And when I look at the compendium, which is the Bible of what you need to learn as a student, and I look at the accreditation standards, and I say, yeah, this is everything a student needs to know. But then I look at the expectation and the models out in the real world, and there's a huge disconnect. The laws and rules and restrictions do not align with the compendium and the accreditation. So you guys are absolutely right. You're asking the right questions. And to me, we need to elevate the field of dental hygiene because the expectation for medical dental integration is to have prevention at the center and to provide those services to the needs of the population. We know that we are the oral health experts and we are the prevention specialists. And we need to collaborate with the dentist and work together side by side so that we can meet the needs of the patients. But what is the role of the dental hygienist? And this is something that I think will increase the needs of the population's access. If we can redefine what the role is of the dental hygienist in a way where we meet the needs of the population and we are working to the scope of our knowledge and keep the standards the same. I do believe that as we move forward, hygienists need to have more education, not less education, because we are going to have a shift where we need to meet the needs of the entire population. And everyone can talk about workforce, and everyone can talk about scope of practice, and everyone can talk about patient safety. But I know that when you graduate as a dental hygienist and you pass your boards, you are competent to deliver care at entry level. And we want to make sure that those restrictions are lifted so that if you want to grow in your learning and develop specialization so that you're meeting the needs of a population, that we've provided a pathway for you as your mentors, both as faculty, as hygiene association members, as dentists, as dental association members. How are we mentoring our next generation? And for you guys, how are you feeling like your needs are being met? If you've met all of your education requirements, what are your expectations for what you want to be doing out in the field? I think these are good conversations. And do you feel comfortable and confident and supported by the elders in the field, those of us that have been out there doing the work? What does it look like for you? What does an ideal job look like for you? What do you feel compelled to do? And what do you feel like your knowledge should allow you to do? These are the conversations we need to have so that we can move the field in a direction that supports the needs of the patients. I know that our graduates, I see what you guys have to learn. I see how much studying, it's so much hard work for you. And then I see the restrictions. So I'm always in conflict about what's the right move to make for patient care and prevention. I hope as students, as you graduate, you go out there and you don't just get stuck in the operatory, that you network with others, that you ask the questions, that you recognize how much knowledge and value you bring to the table, and that you're able to create change in a positive direction to meet the needs of the population. I know it's hard for us to see a pathway to being outside the op because it hasn't been really clearly created. I can tell you there's lots of students that say, I want to be in public health. How do I do that? I feel like we've done our job when students don't even have to ask. They know the path and they know how to get there. Or seasoned hygienists who are out in the field know exactly what they need to do to leave the op, to go into public health. Meeting the needs of the population is the center of what we're doing, right? We are prevention specialists, and dentistry and medical has to come together in order to make this change. I think the pathways need to be clear. I think they need to be created and well defined. And then I think as a student, you need to have confidence in what you know, what you've learned, and then what does that look like in helping a patient? I challenge you to meet and answer that question. Good luck out there as you graduate. I'm so proud of every one of you, those that I know, those that I don't know. And I just want you to know there's a lot of people here for you, supporting you as you embark on your journey as a dental hygienist, as a registered dental hygienist who's a provider who carries a license to do that. Hey, are you in dental hygiene school or just got your acceptance letter and just started dental hygiene school and you're worried about how you're going to fit it all in, what the evaluations are like, what the key strategies you need to set up in order to be successful? You don't want to have worked all this time to get accepted into dental hygiene school only to make some pretty major errors in your first and second semester. I've put together a course that will really help you set yourself straight right out of the gate and get yourself started on the right foot in dental hygiene school. Whether or not you're just entering school or you've done your prerequisites and you're just well on your way halfway through, this course is designed to help get you straight and keep you straight so that you can become a dental hygienist. Click the link in the show notes and check it out. Are you looking for study sheets? I've created study sheets that cover the content of this episode. If you're interested or that's something that's going to help you on your learning journey, you can click the link listed right in the description of these show notes. Happy studying! I would invite you to send me any questions that you need answered. Questions come up when you listen to this podcast. I have a link in the show notes, and I'd be happy to answer any questions that you have. Also, I would appreciate a review if you have time to leave one. Thank you so much.